Hi, welcome to my YouTube channel, Orthodontics by Dr. Kieran Daly. Today we're going to talk about the replacement of a missing upper front tooth in a teenage patient. This is Ava, who presented to my office at about 9 years of age. Ava had previously had a significant trauma to her upper front teeth, and the upper left central incisor or upper left front tooth had actually been avulsed out of the mouth and had later been reimplanted by her family dentist. This is a relatively common occurrence, and the reimplantation of an upper front tooth or incisor carries a number of significant risks. The most common risk is the tooth eventually becomes fused in place, and as the rest or the adjacent teeth continue to grow and erupt, the fused tooth stays in the same position, which creates an unsightly appearance and a difference in the level of the edges or incisal edges of the front teeth. So after Ava had initially presented to us for treatment, we explained to Ava and her mum the risks of the tooth or front tooth being fused, and we agreed that we would attempt to straighten or align her teeth, considering the risks that were involved. As you can see in the photographs, after a number of visits, it's clear that the front tooth is not moving, and in fact eventually what happens is that the adjacent teeth get moved upwards or intruded. After about 6 to 9 months of treatment, we had aligned or straightened her upper front teeth, and then at that point we removed her braces. We agreed with Ava and her mum to wait until just before her teenage growth spurt at 12 years of age, and at that point a final decision was made that we would have to remove the fused tooth so that we could eventually plan to replace it. We carried out orthodontic treatment using fixed or train track braces, and we aligned and straightened both her top and bottom teeth, as well as creating the correct fit of her bite, also known as the occlusion. And then towards the end, we focused on creating exactly the correct amount of space for the replacement front tooth. At the end of orthodontic treatment, Ava's braces are now removed, and we make up a retainer which has a false tooth built inside, and this is worn by Ava during the day as a replacement tooth. It was now decided to carry out a process or produce what we call a adhesive bridge to replace the missing tooth. The adhesive bridge has a special wing that is attached to one of the adjacent teeth, and this secures or holds the false tooth, or what we call a pontic, in place. It's very important that to make this look natural, that it appears like the pontic or false tooth is growing out of the soft tissue or gum tissue. To facilitate this, we've carried out a procedure called tissue forming. Tissue forming is where we use a sequence of retainers that applies a small amount of pressure to the soft tissue or gum, and eventually it reshapes this soft tissue so that eventually, when the adhesive bridge is put in place, as you can see in the final photographs, it appears like the pontic is growing out of the gum tissue. This is called tissue forming, and you can see that it has a very natural appearance. This is a good solution for a patient like Ava until she's into her mid-20s, at which point she could consider something more permanent like a dental implant. We don't consider dental implants in young patients, primarily because they're fused in place, and as the adjacent teeth continue to grow and erupt, it creates a height difference between the implant and adjacent teeth. So, in summary, Ava presented with a fused or ankylosed tooth that was eventually removed. We then carried out orthodontic treatment. We used a pontic or false tooth on her fixed braces as her initial replacement. At the end of orthodontic treatment, we carried out the process of tissue forming, and eventually we replaced the missing tooth with an adhesive bridge. This is a good medium-term solution for replacing her missing front tooth until Ava is in her mid to late 20s, at which point she could then safely consider a dental implant.